Good evening, everyone, and welcome to the second session of this virtual forum series, Bringing the Village to the Children, Conversations on a Collective Approach to Children's Mental Health. My name is Desiree DeBella. I am an ACAP Emerging Leader Fellow, as well as a child and adolescent psychiatrist and pediatrician, and I'll be guiding tonight's conversation, or today's conversation, depending on where you are. This series is part of ACAP's presidential theme, which focuses on strengthening collaborative multi-sector approaches to supporting the mental health and emotional well-being of children and adolescents. And this session is especially focused on the intersection of child psychiatry and juvenile justice. We're honored to be joined by Dr. Alicia Barnes, an ACAP member and child and adolescent psychiatrist with experience working with youth and their families facing mental health and trauma-related challenges, particularly youth at risk of entering the justice or child welfare systems, as well as being joined by Joey Orduña Hastings, a juvenile justice expert and chief executive officer at the National Council of Juvenile and Family Court Judges. So I thank them both for being here and sharing their expertise. Just as a reminder for the members who are joining us today, if you have any technological or logistical questions, please enter them into the chat and ACAP staff will assist you. If you have any questions for our panelists, please be sure to put those in the Q&A box. Please note that just due to time constraints, it's unlikely that we will get to every question in the Q&A, but we will try our best to answer as many as possible. So we will go ahead and get started with Joey and Alicia. Welcome. And for our first question tonight, I just wanted to ask you all to share about your backgrounds and what role that you each play in supporting children's mental health and emotional well-being. Alicia, if you could go first.
Hi, thank you for having this important discussion this evening or day, wherever you are. I'm joining from Memphis, Tennessee, and I started a new role as Urban Child Institute Chair of Excellence in Child and Adolescent Psychiatry. And here, as many places around the country, there are not enough child psychiatrists child psychiatrists in the correct place to serve the needs of children, knowing how large it's expanded in the last couple of years, this crisis post-pandemic and otherwise. So one of the things is thinking about how to address that need in a systemic way, especially being in this role as a division director at Le Bonheur Children's Hospital as well, being able to put those different pieces and different systems together to meet the needs of that time, to think more about well-being and not just about illness.
Hello, I'm Joey Orduña Hastings. I'm the CEO at the National Council of Juvenile and Family Court Judges. Thank you so much for putting this important webinar series together. I think all of us can learn from all the various episodes, so I'm honored to be a part of this. So by way of background for me, before coming to the NCJ, FCJ, and after law school, I had the privilege of working in all three branches of government as a court administrator, as our governor's legislative director, and then as an assistant county manager. And in all those positions, I had the privilege of working with children and families in our communities. And one of the things that I think when I started as CEO of the NCJ, FCJ, I just started my 10th year this month, was really being able to lift up that judges are often not perceived as traditional partners in supporting healthy families and healthy communities. And we know with the right training on the law and research and science and data that judges can be instrumental in changing for the better the trajectory of a child's life. NCJ-FCJ has a hashtag, and it's every court, every child. And when we note that hashtag, it's very intentional because we truly believe no matter the age, no matter the circumstance of that child, we know tragically that children we see in family court often find themselves in the adult criminal court. And NCJ-FCJ, through its work, we just turned 88 years old this year, really strives to be a collaborative partner in breaking that cycle. So greetings from Reno, Nevada, where our head office is, but I also want to bring you greetings on behalf of our independent research arm, the National Center for Juvenile Justice in Pittsburgh, Pennsylvania. I'm hoping through this conversation today, we'll be able to talk about the judges' education and training, but not only judges, really we work with multidisciplinary professionals in the court system on all matters of behavioral health, child welfare, juvenile justice, domestic violence, and domestic relations. And so much of our work now, and has been for 30 years now, has been grounded in trauma-informed and trauma-responsive practices that truly are vital to any judge's knowledge of the cases that come before them. And quite honestly, the complexity, as Dr. Barnes was saying, not only since COVID, but these issues have been around for years. We're in some ways just finally recognizing and talking about them and hopefully breaking the stigma.
Thank you both. I would love to hear more about, in your various experiences, how does fostering emotional support and like that social connection help children and families thrive? And if each of you could share a moment in which this you made a meaningful impact, or you saw that there was a meaningful impact.
Think early on, we see a lot of early interactions. We stress babies' attachment to children, to their parents, and making sure that they have that early bonding with a primary caregiver. And that continues into early childhood as well, in elementary school, and even into adulthood in many ways. But sometimes we miss it with our adolescents, and then because they're also getting influences from peers, but that primary caregiver and building that relationship is so important. Having a trusted adult that you can depend on, that carries throughout one's life, and then also sets the framework for children to have positive relationships as they grow into adulthood, and then make decisions on partnering and starting their own family. Those things start early with that primary caregiver and really building a trusting relationship. So having that is really important. And hope we always promote family strong families to initially support that. But really, a community member, a primary caregiver, sometimes it's grandparents that step in and have that consistent role as primary caregivers, that can really make a difference. And it's always amazing to me, because as adults, sometimes we underestimate the role we play in a child's lives and the words that they remember us saying. And so I would say those things, that just kind of is a consistent experience that happens over and over again, that's a primary thing, to have that relationship with an adult.
I would note from a judiciary perspective that the way that NCJ-FCJ helps foster those social connections is really making a point of listening to the families that come before the judges and the court professionals that we work with. NCJ-FCJ really has, I would lift up two fundamental publications for this conversation, which is our Enhanced Resource Guidelines and our Enhanced Juvenile Justice Guidelines. Both are 300-page plus publications that really educate judges on how the cases flow, who are needed to be in the room, what experts, the importance of engaging family, trauma-informed practices, and also trying to keep families together. We know when we can't keep families together, there might be adoptions that happen. And I was talking to a little boy who was recently adopted, who's 8 years old. And some of the things he said that were most important to him about adoption was he felt safe and he felt loved. And, hopefully through the work of NCJ-FCJ and listening to those with lived experience, we can create a community for the children and the families. There are professionals in the courts now called parent navigators or parent coaches that can help through their own experiences and peer-to-peer mentorship to help families navigate these systems. But I would also say that sometimes we forget the simple efforts of trying to create a dignified space by using people's names, using plain language and not jargon, and making them feel like outsiders in the courtroom. We are about to launch in July a new trauma-informed courtroom practice bench card for judges. And I say judges, but this is really for everyone. You know, the work that we do, we want everyone to know what the judges are being trained on, so that we can try to best inform what happens in that courthouse, but then also not needlessly keep people in a court system, you know, when they need to move out into the community. One project that I do want to make sure that we talk about is, we know that 90% of youth involved in juvenile justice and child welfare have experienced a minimum of one adverse experience. And this normalcy to trauma exposure is justification enough, you know, to really talk about trauma-informed practices and responsive efforts. We have a project called the Adolescent Recovery Oriented System of Care, and we refer to it as ASRO. And this project is embedded in select courts for juvenile drug courts. And it really does try to focus on the recovery of children from a specific child and adolescent development issue. And recovery really can be tailored to the child's needs, their interests, their spirituality, their communities. And that goes back to, we have to be able to listen, right? We have to make sure this is as reciprocal of a process as possible. Dr. DeBella, you're on mute. Sorry.
Oh, thank you. You're paying attention to the specific pieces that make up that foundation and structure that Alicia was speaking about, you know, from that very beginning, from when they're infants and youth. Joey, I would love to know more, because you already spoke about collaboration with the parent navigators, with the judges, with different components and different individuals of your work. Is there anyone else or any other areas that you partner with to support children and families with your organization?
Absolutely. So as we want to be at the table of systems change efforts, we want to bring others to the table of the efforts in the judiciary and really try to demystify what's going on behind those closed doors. So NCJ, FCJ, through our vast membership, you know, we serve about 30,000 professionals throughout the country. We encourage, through judicial leadership, the ability for judges to convene people in their community. Every community has their own culture and dynamics and resources, and sometimes own deficits in resources. And we really want to ensure that we're partnering with the medical professionals, education, law enforcement, universities, you know, probation departments, and all of those things to help make the system more informed and much more intentional. One of the key principles of our organization is for judges to also seek the expertise of others, that they don't need to be the expert in everything, and learn to weigh the expertise that is provided to them in court or through motions and hearings. NCJ, FCJ is a national education entity, and we not only prioritize including lived experience professionals and peoples into our work, but also multiple disciplines, and we train across disciplines on topics of substance use disorder, suicide prevention. We're seeing more and more children, younger and younger, committing suicide. The managing social media and the impact that AI is going to have on children and in the courts, and then over medication of children in the foster care system and the juvenile justice system. You know, we also track really innovative practices that we're seeing some of our courts throughout the country, in both state and tribal courts, start to learn about and develop. Things like juvenile drug court or mental health courts, and most recently even autism court, where there can be specialized and tailored services for children with autism and other needs. And so it's really important to us, not only as an education entity, but also as a membership organization, that we really open our doors because there's so much that we can learn from each other. When we look at our populations in the courts in various states, and then we look at the hospitals and the emergency rooms, or where children are being referred to for removal, if you will, in child welfare cases or delinquency matters, they're the same people, they're the same children, they're the same communities. And so we believe the more that we can align, one, the most efficient we can be in our education and understanding, but also the resources are so limited that we need to collaborate. We don't have a choice not to collaborate.
Alicia, could you talk about how in your work you collaborate with juvenile justice professionals, social workers, schools, and what makes those partnerships effective?
Yeah, I think there's a great point. Just making ourselves available, especially as psychiatrists, we all get trained in our own lanes and silos, but then making ourselves available, because we do see the same children and families interacting with these complex systems regardless, and sometimes it's intergenerational. And so what we see is it's really bringing those children and families going back to their community and seeing them and meeting them there. So usually the children that we see in the juvenile justice system, they start and have lots of different needs, but taking that back to their community when they re-enter or return to their community, that's where a lot of the needs are seen. And so doing community-based events at churches, at synagogues, at mosques is really important, really interacting and partnering with the schools. We have a couple of programs where we're integrated into the schools and providing that mental health care, mental health access to care there, but so that it's easier. It's not as much of a barrier, because a lot of times with our children, we still see a lot of stigma around mental health issues. And if you say go one other place to find help, there's a lot of things that can get in the way of going to that next place to receive services. So a lot of it is actually returning to the community where those children and families are and building up the resources and networks there. And again, it's a lot of times we get trained in our silos and we're hospital-based, but really taking a community psychiatry approach and thinking about how do we go into those communities and provide services and make ourselves available. So we're not the stranger that nobody's ever seen and nobody knows what we do, but we're actually a part of that community and known to people that are trusted and that have lived experience there. So just centering that is really based around what the work that we do.
I would add to that often the courts are in the position to also be those trusted professionals that you see frequently. A lot of our judges would say 90% of their job as a judge is in the community and off the bench, getting to observe where children or families might be sent for resources, understanding workforce development, or the challenges facing our unhoused youth, or the challenges with hunger and poverty. We have a school justice partnership project that we've done for years, wherein we literally go into the courts and the school districts to create MOUs so that children are not automatically sent to the court, but working with the school resource officers and other education professionals and teachers to de-escalate a situation, get resources. And I would also say, as important that the psychiatrists and the medical professionals are too, it's important that we also look to other mental health resources that may include sports, arts, music, and pets, and how animals can really be used to help children ease their anxiety and things like that. And so I think there's being visible, being familiar, being trusted really offers some creativity that we all can do together. And again, bringing the courts, out of the courts and into the schools and in the community, but in a way that is prioritizing humanity and not the punitive nature of how courts are perceived.
Sounds like both of you are talking about centering this availability and leaving the places where we're traditionally thought that our place is and going into the community and making sure our care in that community and services in the community are authentic. Um, yeah. So when you think about then wanting that work to be authentic to the communities that you're serving, how do you all ensure that the work is inclusive, and culturally responsive? And are there any lessons that you all have learned kind of along the way with your work that could help others build more equitable kind of mental health practices? I will go to Joey, you first, if you want to comment.
Yes, happy to talk about that. So NCJFCJ for decades has made the inclusivity and access to justice and procedural justice priority areas of our work. Our curricula is literally based upon not only the law and research and data, but those in the community that we are serving, having them at the table, building a collaborative where we ask questions, but then we also sometimes we forget we have to listen. And so we train a lot on bias and compassionate listening. I would also suggest that when we talk about family, that we're not talking about just the families that are involved, but their aunts, their uncles, cousins, maybe people that in the community may not be cousins by blood, but that's what their community, that's how they refer to them. Godmothers, godfathers, so on and so forth. And so really bringing everyone in to be able to be listened to. You know, I'm very proud that NCJ, FCJ, our values are compassion, leadership, education, and community. And so often when you realize that compassion is a skill, it can really help navigate that cultural understanding, the willingness to listen, putting aside your biases. You know, often judges have to remember, and court professionals have to remember, that not every family is the same and not every family was your family. So just because you had your own room as a child growing up doesn't mean all children do. And really stepping back so that we, again, don't further encumber families into a system when that's not what they were brought in here for.
Alicia.
Yeah, I think I agree with that. All that was said, I think there's some exciting things that we have in Tennessee, and each state is a little bit different. So it's great to have organizations that kind of bring together these great ideas and programs that support families. In Tennessee, we have family support specialists that are peer support specialists that are parents that have had the experience of a child with a mental health issue and navigating complex educational juvenile justice systems. And they want to develop a career path to go walk aside other families and help them navigate those systems. And that's something that's reimbursed at a state level. So we have programs like that, and then also relative caregiver programs. So another complex system, the foster care system, a lot of times one of the challenges is actually finding homes or relatives that are able to care for children. And so having a system that reimburses them along the way with the things that we know are just barriers in childcare along for all families, for many families, is really important in championing being able to produce the positive relationships we're talking about and having those trusting relationships for long periods of time. So championing each of those is really important. And then it's kind of becomes automatic, the inclusivity, right? Because you have the right people at the table and the community advisory boards, and making sure that you're having those inclusive conversations and asking for the input, not only input, but the advice of all of the members that are at the table that have those lived experiences.
I would also suggest that a good practice from a real practical sense is in the courts, well, two things. In the courts, when we know that children and families are on the child welfare docket, so, you know, that case that a particular judge might have related to child abuse and neglect, Well, we have the mechanisms to see if they're on other court dockets. Are they on the juvenile justice docket? And is there a domestic violence case? Is there a child support case? And one of the things that we encourage courts to do through good case management is to then put all those cases before that one judge and organize it in such a fashion that we're not always trying to bring these families back to court. Maybe we have virtual hearings and a lot of things that we learned during COVID, but even having to come to court on different case types, there's a way to create an environment that's much more respectful and inclusive because we know where your cases are in the court. And so that you don't have to retell your story over and over again. And then secondly, I would also say that, at least from what I've been talking about thus far, we're talking about kids and families that are in court. There are so many at-risk youth in our schools that may not ever come into court, and they may be the star quarterback. And the importance of having medical professionals and counseling services and people like you, Dr. DeBella, and you, Dr. Barnes, in the schools can really help address those issues before they become court involved or gosh forbid, impact and try to impact their own life. And so there are interventions that can be organized through strong collaborations and judges being at the table still that can really help at all levels of the child's intervention and the family's intervention or engagement.
Yes, connecting our further collaborative efforts from our last session as well for our school-based settings. Yes, exactly. So when you're thinking about how to track progress and how do you know that the interventions that you all are putting in place and wanting to put in place, what's working and tracking outcomes, like how do you all know, we'll start with you, Dr. Barnes, Alicia, like how do you know that kids are thriving and that what you put in place is kind of doing what we think we want it to be doing?
Yeah, I think starting from a place, well, we're building academic community partnerships, which is, it's a goal and it takes time. But one of the things that's key to that is measuring community engagement and just our ability to keep trustworthy relationships with our partners in the community. So that's a key part of it. I think the academic part, of course, is really outcomes based, but usually what I find is organizations out in the community are doing this work on a regular basis. It's really building the capacity to track, not even track, but to share all of the good work that's being done and that the impacts, because we talk about sometimes resources being limited for these interventions, but the juvenile justice system is very resource intensive, and thinking about the lifespan and the outcomes of the children that interact with that system and how they return to communities and what they're able to contribute to those communities. Children are our future, they're full of potential. And so it's really those outcomes, if they're poor outcomes, we're losing a lot as a community when we're not putting place that show those positive outcomes and interventions that families and the youth trust, but also that show that there's it's family guided and youth are involved in it as well.
I would agree with Dr. Barnes said, relationships are some of our strongest tools that we have, especially as I think we've all experienced in the last 4 to 5 years, so much turnover, right? In community resource leadership, people at the schools, people at the courts. And so fostering those relationships and communication are key. But I would be remiss if I didn't say you must evaluate where you can, and looking at the data. We have had the fortune of being able to evaluate the effectiveness of our trainings at the National Council of Juvenile and Family Court Judges. And for example, in our enhanced resource guidelines training, which is child welfare focused, we know that the trainings the judges have gone through has reduced the youth's time in care while moving to a permanent placement, whether that be reunified with their family or adoption, have been reduced by 112 to 134 days. That's significant in a child's life. We know this. I have in the back of my mind often a judge who retired, and right before she retired, and I won't say the state, but right before she retired, a decision she made on the placement of a child went up on appeal. And that decision was not decided for 4 years after that decision. She'd been retired for 4 years. And what sticks with me is not only that timeline of that decision being done, but also that's the high school years of a child. And sometimes we forget that a child's mind doesn't move like ours, and some of this can feel like a lifetime. And so tracking is key. I would also stress that sometimes, and unfortunately, in a child's life in the court system, sometimes the judge is the most stable person that they've had in their life because of maybe turnovers of attorneys or social workers or educators, so on and so forth. And so it does come back to the importance of that relationship and really valuing each other as humans, navigating this together.
When all the programming and that you all have mentioned, all the interventions that you all have mentioned in this very dynamic and quickly changing landscape, what are some of the biggest challenges that you all and your organizations are facing right now, whether that be systemic, political, or like policy related, and how are you adapting to these shifts? Joey?
As our organization is a nonprofit, we have faced many challenges like other nonprofits have in the country. The monies that we receive, like many nonprofits, is soft money, and sometimes it feels softer on some days than others. But the thing that we continue to persevere forward is the calling to this work, and the fact that children and families need the support of our system. We know that we can't do this by ourselves. We don't have the resources to do it by ourselves, which is why collaboration is so key. Post-COVID, in some ways, it's really good that we're having these difficult conversations and challenging each other to recognize and see people differently than maybe what we saw before, and making assumptions about people. I still think that one of the biggest issues we have, not only for the families the judiciary serves, but also the judiciary, is the stigma of having to manage their own mental health. As judges are called to be the problem solvers, sometimes they don't have the answers. And which is why I think it's refreshing to say, ask the families what they need. Ask the medical professionals what they recommend, and really come at this from a problem-solving approach that can support everyone. NCJ, FCJ truly does believe healthy judges make healthy decisions. And with that, they also have to recognize their own mental health and their own challenges, their own stress levels, maybe burnout, and really welcome support and education and skills to make those improvements. But stigma continues to be the challenge that we face in this work. Being able to talk about it, and it not being a secret handshake that you have with just a few people, but it's something that we can make part of our professional fabric, right? That wellness is a skill set. It is a leadership skill. And I think when we can get past the stigma, I think environmentally things will become healthier too.
Alicia?
Yeah, I think we're facing some of the similar challenges of in academia, trying to balance, hard dollars, soft dollars, and pushing education in these areas and adding something to curriculum about broader systems that interface with children. I think one of the other challenges we face is just traditionally in the medical model, it's not something that's always had a place in training, even in residency or in fellowship. There's not always a place where you have real lived experience interfacing with community members, and building that into our training model really makes a big difference in improving our outcomes. But with the already packed schedule, it's figuring out how to add that in. And then also it's a different language in some times, in some spaces versus, how do you, where do you publish? Where do you have these conversations? When it's not necessarily the biomedical model that is traditionally spoken about with the nice protein and neuron showing the neuroreceptors moving across the synapse. So that language barrier sometimes presents itself as a challenge. But I think the need and the interest of our students and our trainees definitely echoes this kind of hunger for this type of this education and exposure early on in training, but it's definitely bridging that gap to build it into our training. And so, in our division, that's something that we're working towards, to have that exposure earlier on.
And
There's
if I
never,
might, I'm sorry, if I could
no,
add
go
one more
ahead.
thing. One of the things that all branches of government, I think, are facing, and I think the medical community is facing also, is having the media as a partner in this to help educate the public about what's going on with youth, teens, young adults, and unfortunately being very clear about what the data is showing related to the uptick of this type of delinquency behavior or this behavior. One of the things that we continue to need to reinforce is that we are talking about children. We know their brains are not fully developed. We know that when they get older, they get better, and more awareness of the pros and cons and consequences of their actions. And so when you talk about, or you ask about, kind of the environment we're living in right now, I would also say bringing the media close into the work is also helpful. We often encourage judges and court professionals to have, a member of the media shadow them where appropriate into the courthouse, or a legislator, bring them into the courthouse so they understand why these matters are urgent and how little resources are actually allocated in a budget at a county level or a state level to really support, or a federal level, to support the needs, the vast needs and complexities of the family. So I would also say part of navigating is welcoming more people into your world so they can have a better understanding.
Yes, you both speak to how much interest and how much need there is to include more training within our already packed, kind of list of our rotations and experiences that we have to do. But I do feel as though with more outside opportunities, even outside of like our training programs, like through ACAP and their legislative conference and exposure to advocacy there, through seeing more of the media aspects of different individuals within the community, pediatricians, child psychiatrists, talking about hey, these are real things that are going on in medicine, but in lay terms for the public. Even seeing some of that as a trainee is, that exposure helps train you as well. So yes, those are all fantastic points. And thinking ahead in terms of advice and opportunities, what do you all feel, what guidance would you offer to others who are working to strengthen support for children's mental health in this sphere? And specifically, Joey, what advice would you give to professionals, maybe they're child psychiatry adjacent and they want to support youth mental health through the like legal or policy work? How do they build those cross-sector partnerships?
Reach out to the courts. Every court has a court administrator. I was a court administrator. Call the court administrator and say, hey, I'm interested in this. Is there a way that I can help? I would never turn down someone saying, I would like to help or learn more, right? And so reach out to the courts. Talk to your family members. I'll often do an exercise at the beginning of trainings or presentations where I ask people, keep your hands up, but how many of you know someone who's been in the family court? How many of you have been in the family court? Or how many people have been in the family court? More often than not, almost every single person in that room is lifting up their hands. And so talk to your friends and your family, ask questions, be curious about it, but also please see judges as partners in and bringing them to the table in these conversations. Um, you know, Judges, we're partners and work closely with the court-appointed special advocates, the CASAs, and various GAL groups and guardian ad litem's groups and things like that. And we encourage them to always have judges come in and participate in their training. So as you're training young medical professionals, have a segment where a judge comes in and says, this is what I see in court. This is, the child welfare. These are the pictures that me and my clerk have to see of that child, the burns and the abuse or whatever it might be. So engage, but then also when invited, please take the judges up and the courts up on coming and participating. It truly does take the community to come out. And sometimes it takes the community, like during COVID, we knew a lot of resources that shut down. So there were no places to send the kids, especially in their own communities. And sending a child outside of the community and breaking those family ties or cultural ties is not good. And so sometimes together we can advocate for resources and programs to come back that may have been lost during COVID or because of financial cuts. But I would say, if not invited, open the invitation and engage your local court.
And Alicia, when thinking about, medical students and residents, how do you think that they can get involved in systems level work, especially in the collaborative efforts that we've talked about tonight?
I know what Joy has mentioned, that, getting involved, being involved, reaching out. As a student, I did a lot of education, with the local church that had questions about what is mental health. So I think it's a lot of times in our experience of training, we kind of aren't always reaching out to our community, but making yourself available and being curious and interested in identifying yourself as a member of that community, it can be really helpful and lead to opportunities to also build partnerships and further explore. So I think that would be just that initial interest. I also want to say the American Psychiatric Association Foundation has a judges and psychiatric leadership initiative where they're actually training judges and psychiatrists together to have these conversations and train other judges about interventions and other pathways like drug use courts. So to limit the docket for those people with severe mental illness, because again, we know sometimes these have intergenerational aspects to them.
Dr. Barnes, I'd love to learn more about that program. And I did offer Dr. DeBella that we would put together a list of resources of NCJ, FCJ resources that are available and free to the public. One other groups that I should have commented that we are engaging are law students and high school students. Sometimes because of what happens in a child's life, they think that forever, puts them in this place and they can't go to law school or they can't go to medical school or join the military. And so our judges at NCJ, FCJ have done a lot of efforts to get out to the high schools, get out to the law schools. We even have law students as members and law schools as members because we want them also to see the practice of family law, like the practice of, family medicine and pediatric medicine. Sometimes it's just not seen as that area of the law or medicine maybe as the most prestigious area, and truly the impact and the change that you can make on a child's life at the beginning part of their life when they're still being shaped and formed, it's really immeasurable. And so we also encourage law students to think about family law as a priority area of practice.
Thank you both. I'm going to go to the Q&A and read out some of the questions there. So one question that was asked is, what do you think is the role of a child psychiatrist working with a child who is court involved? And how can a child psychiatrist maintain an approach of shared decision making within potentially charged landscape of caregivers and involved parties with different opinions?
So I guess I'll start. I think it's really about approach, and making sure that I think what we're talking about is collaborating, but just it reiterates the importance of centering the approach on the child or the youth that's involved in their family, because without their input, buy-in, direction, we really can't go, it's the outcomes never show up without that. So I think reminding our peers and developing systems and policy that center that is important. in the short term, I think advocating whatever program is in your area to do that. Like I mentioned, we have the family support specialists. That's one of the things they shine at. They do really well. But in every state it's different. So thinking about what those programs are and learning about them so we can voice the need for those things, because otherwise the outcomes don't, they're not positive, because that it's not sustainable without their direction.
I would agree with that, and just really stress the importance of making the invitation or making the introduction to the court. Let them know that you're available. Through the NCJFCJ's trauma audits, we have been able to go into courthouses and really reinvent space that is much more trauma responsive, and it has opened partnerships, whether it be for domestic violence advocates or child advocates. There's one of the courts that we work with in Allegheny County in Pittsburgh, worked with the local hospital to create a small, almost satellite office in the courthouse for the local hospital to come in, and whether it be giving vaccinations or whatever it might be. Once you can create that trust and partnership, the opportunities are really endless. NCJFCJ stresses the importance of having all parties represented and getting resource and experts to come in. And the families that we primarily serve have no money for any of this. And so it is also working within the community to see how some of these services can be provided when you're really working and serving people that are far below the poverty level. And so building those relationships is key.
Related to that answer, Joey, there is a question asking about how do judges in courts seek medical input from child psychiatrists and pediatricians regarding the children before them?
So sometimes the judge can order it,
Mhm.
and sometimes the attorneys order it. It is expensive, and ideally there might be a sliding scale for that doctor to provide that service. But oftentimes, if a judge might feel he or she needs more information, they may order it. But again, so I'll just say, in one state that I'm familiar with, there's one forensic pediatrician in that state. And so sometimes not only do you want to order it, you might not be able to. And then is the person qualified to provide the assessment and the diagnosis or the treatment that you're hoping for? And so it does sometimes take good conversation between the attorneys, the social workers, and the judge to see what best resources in the community. We encourage judges, do a mapping exercise in your community. Find out who's doing what's the reputation. Meet with them, go unannounced and go into their offices and see how are things going, and talk to people that have been through their programming, because not all things might be the solution that you're seeking.
Mhm. And in the materials that you talked about, we'll have them connected to our recording, but will there be information about how ACAP members can learn more about your organization and learn more about interfacing with the juvenile justice system?
Absolutely. And I know one of my judges is probably, if she's watching this, saying, and we're not just for judges. We want multidisciplinary members of our organization. We want the sharing. NCJFCJ is about to launch, through funding from the State Justice Institute, a Science for Judges distance learning series for this very purpose, like what Dr. Barnes was saying, bringing the medical community and the judges together to best understand. So I will absolutely add that information into our resource page, and would love to have you at our conferences and us at your conferences, really, because together the children and families we serve will be better for it.
Absolutely. There are two more questions. Hopefully, we'll be able to get to these. So, there is a question asking, is there a policy to support mandated mental health screening and follow-up psychiatric care for youth in juvenile detention? And connected, once youth are in detention, do they continue to be eligible for Medicaid?
So there's no mandate, and I think that absolutely there's a challenge of finding resources. Sometimes I have worked in a detention center previously, and there's a difference too between being a treating physician versus being a forensic physician rendering a decision or input or expertise on a case, and how their mental status might relate to what's to the case specifically, versus being a treating physician. But I would say sometimes that's the first time they've ever received psychiatric care, and it's been an ongoing need for psychiatric care with a family history. So it's not mandated, but a lot of times families are open to it, especially given it's an access point to care that a long time has been ignored. But recognized by the family as a need. Medicaid is available to youth when they're in detention center. So I don't know if that will change, but for right now they are. That they have, again, that's one of the ways you have access. Ideally, you get access to medical treatment before it becomes an issue. So I was really excited to hear about like the autism courts, because a lot of times with developmental delays, we find that children are impressionable or in situations with peers, that all of the children have peer pressure, but especially with developmental delays, they're in groups and they're charged as in some states they can be charged as adults, and they're facing these charges that they don't completely understand. And so that evaluation and having other pathways to really recognize those challenges is important.
And I might just to lift or add on, again, going back to when children are in detention, you're not only looking at their medical needs, but also their education needs, sports they might be interested in, art, music. You know, we use equine therapy in some of the work that we do with judges, and they use them with equine therapy with the children that they serve. And so sometimes there's a balance also that can be found for children and their mental health on the non-traditional mental health services too.
Oh, there was a response in the chat, and it says youth are not able to use Medicaid funds in detention. So maybe that. is somewhat different. Any comment? Dr. Barnes, Joey?
You're muted. I would say it's state specific Medicaid, so
Ah,
Yeah.
yeah. Thank you. Thank you for answering for that comment. Um, Thank you both for a truly thoughtful and engaging conversation today. Um, in terms of thinking about our goals and really wanting to understand how we can build and sustain a more collaborative system, I think this conversation is crucial and that I certainly learned a lot, and I think can speak to the individuals who joined tonight that there was so much information that I want to look up. I'm so glad we're going to have more resources, Joey, that you're going to provide, and that can be disseminated amongst individuals who weren't able to be here tonight. Thank you for your time tonight and for all of the time you spend in the communities and with children and their caregivers. Is there anything else that you would like to share or mention for tonight?
Just thank you very much for this opportunity, and please don't forget about the judges in your community when you're putting together task force and other collaborative opportunities. Thank you.
Yes. Absolutely.
yes, thank you for lifting up this important subject in the series, and I'm looking forward to the next one.
I am as well. Both of you talked a little bit about foster care and youth in foster care. So I said, oh, perfect mention for our next session. So thank you to Dr. Alicia Barnes. Thank you, Joey Orduña Hastings. We are going to put up a slide for our members for information for our final session of this series. It will be on July 29th at 8 p.m. Eastern, and the topic will be on foster care. So thank you, everyone, and everyone have an excellent rest of your day.